Have you ever caught a glimpse of yourself in the mirror and noticed something new? Maybe a little spot, a change in your skin you don't quite remember seeing before. It's easy to brush these things off, isn't it? We tell ourselves it's just part of getting older. Another wrinkle, another sign of the years adding up. But what if I told you that sometimes? Those seemingly small changes, those little marks on your skin, could be whispers your body is sending you, whispers you really shouldn't ignore. We often fear the big health problems. But the truth is, some of the most serious conditions, including certain types of cancer, can start small, showing up in places we can actually see. There's one particular area, or rather, a type of spot, on your body that can be a really crucial early indicator. Especially as we get older, ignoring changes in this one spot could mean missing a vital early warning. In this video, we're going to look closely at what this spot is, why it's so important to pay attention to it, and what signs to look for. We'll dive into how simply knowing what to look for and taking a moment to check can make a world of difference in your health journey. Watch to the end for something that will surprise you about taking control of your health. So, let's talk about this crucial area, this spot I mentioned. It's something we all have, in varying amounts, and it's constantly exposed to the world around us. I'm talking about your skin. And specifically, those little marks that appear on it, things like moles, freckles, or other blemishes. For many years, we might not pay much attention to them. They're just us. But as we age, our skin changes. It might get thinner, drier, and it also shows the history of our sun exposure over a lifetime. Those moles and spots that seemed innocent for decades can sometimes change. And those changes are what we need to be aware of. Think of your skin and these spots as a map of your life, but also potentially a very early warning system. The most common spot people think of are moles, medically known as nevi. Most moles are completely harmless collections of pigment cells, and most people have between 10 and 40 of them. They can be flat or raised, smooth or rough, and they can vary in color from tan to brown to black, even pinkish. We often get new moles during childhood and adolescence, but it's less common to get many new moles in older age. So, if a new mole pops up when you're in your 60s, 70s, or beyond, it's something worth noting. But more importantly than new moles is paying attention to changes in existing ones. This is where that crucial early detection comes in. There's a simple system that many doctors recommend for checking moles yourself, and it's often referred to by the first few letters of the alphabet A, B, C, D, and sometimes E. Let's break this down because understanding these simple points is key to knowing what to look for in that important spot. A stands for asymmetry. Imagine drawing a line through the middle of your mole. If the two halves don't match, meaning it's asymmetrical, that's a warning sign. Normal moles are usually symmetrical, pretty round or oval. If one half looks distinctly different from the other, like one side is larger, darker, or a different shape, that's something to pay attention to. It suggests the cells might not be growing in a uniform, organized way, which is what you see in benign moles. Think about a healthy dinner plate, usually a nice, consistent shape. An asymmetrical mole is more like a plate that's been squashed or pulled out of shape on one side. It's not necessarily dangerous, but it's a signal that warrants a closer look by a professional. B stands for border. The edges of a normal mole are usually smooth, even, and well-defined. You can easily tell where the mole stops and your normal skin begins. If the border of a mole becomes irregular, notched, blurry, or ragged, it could be a sign of trouble. Malignant moles often have edges that spread into the surrounding skin without a clear boundary. It's like the difference between a neatly drawn circle and one drawn by a shaky hand, where the ink bleeds out at the edges. If you notice a mole whose edges seem to be fraying or difficult to distinguish clearly, make a mental note. This irregularity suggests the cells at the edge are growing in an uncontrolled manner. C is for color. A benign mole is usually a single shade of brown or tan. It might be lighter or darker, but the color is relatively uniform throughout the mole. If a mole has multiple colors within it, shades of brown, black, red, white, or blue, that's a significant warning sign. Different colors within the same lesion can indicate different types of cells or changes occurring within the mole. Think of it like a painting that suddenly has splashes of completely different colors where it should be just one shade. This variation in color points towards potential uncontrolled growth and is a strong indicator that the mole needs professional assessment, even if it's just 2 shades of brown where there was only one before. That change is important. D stands for diameter. Generally speaking, moles that are larger than a pencil eraser, about 6 millimeters or 1 to 4 inch, are more concerning than smaller ones. Now, it's important to say that many harmless moles can be larger than this, and some very serious ones can be smaller. So, size alone isn't the only factor, but a mole that is larger than 6 millimeters should certainly be checked, especially if it also has any of the other warning signs. Even more importantly, if you have a mole that is growing rapidly, regardless of its starting size, that's a major red flag. A mole that was small last year but is now larger is exhibiting a change in diameter that needs attention. Don't get too hung up on measuring precisely. It's more about noticing if it looks significantly bigger than it used to be. And E stands for evolving. This is arguably the most important sign to watch for, especially as we get older. Any change in a mole, in its size, shape, color, elevation, or any new symptom like itching, bleeding, or crusting, is a potential warning sign. Moles that are becoming cancerous often change over time. If a mole that has looked the same for years suddenly starts to itch, bleed when scratched, feels different, maybe lumpy or hard, or just looks different in any way, that evolution is a critical signal. Think of it like a weather forecast. A steady, unchanging forecast is usually fine, but a forecast that shows rapid changes from sunny to storm clouds is a sign of potential trouble. The evolving criteria really ties together the asymmetry, border, color, and diameter. It emphasizes that change is key. Even if a mole is small and symmetrical, but starts to itch constantly, that symptom counts as evolution and warrants getting it checked out. Regularly looking at your skin and knowing your moles helps you spot these changes early. It doesn't have to be a scary or overwhelming process. It's just becoming familiar with your body's landscape. Now that we've covered the basics of what to look for in moles, the ABCDEs, it's important to realize that moles aren't the only visible signs on your skin that might need attention. Beyond moles, there are other kinds of spots and marks on your skin that can be significant and fall under the umbrella of looking at this one spot, meaning your skin as a whole, for early indicators. For example, have you noticed any new bumps or growths that don't look like your usual moles? Sometimes these can appear as pearly or waxy bumps, often on sun-exposed areas like the face, neck, or hands. They might be flesh-colored or have a slightly translucent appearance. These could be signs of basal cell carcinoma, the most common type of skin cancer, which thankfully is usually slow-growing and very treatable if caught early. They might also look like flat, flesh-colored or brown scar-like lesions. The key here is newness and persistence. A temporary bump from an insect bite is one thing, but a bump that appears and stays, or slowly grows, needs checking. Another type of visible change to watch for is a non-healing sore. We all get little cuts, scrapes, or spots that take a few days or maybe a week or two to heal. But if you have a sore or a patch of skin that bleeds easily, scabs over but doesn't heal completely, and keeps coming back, that's a significant warning sign. This could be a sign of squamous cell carcinoma, another common type of skin cancer. These often appear as firm, red nodules or flat, scaly, crusted surfaces, usually on sun-exposed skin. A sore that just won't go away, even after several weeks, is a strong indicator that something isn't right and needs to be looked at by a doctor. Don't just put a bandage on it repeatedly and hope it goes away. Get it checked out. Sometimes, persistent red or scaly patches that might itch or feel tender can also be a warning sign. These are different from dry skin patches that improve with lotion. These are patches that don't go away, might get bigger, and can sometimes look inflamed. While many things can cause red, scaly skin like eczema or psoriasis, if a patch is persistent, growing, or doesn't respond to typical remedies for dry skin, it's worth getting evaluated. These could potentially be early squamous cell carcinomas or other precancerous lesions like actinic keratosis, which are rough, scaly patches that feel like sandpaper and are caused by years of sun exposure. Treating actinic keratoses is important because some can develop into squamous cell carcinoma over time. It's also important to look beyond just the main areas of your skin that get sun. While sun exposure is a major risk factor for skin cancer, these changes can appear anywhere, including areas not typically exposed to the sun, like the soles of your feet, palms of your hands, under your fingernails or toenails, or even in areas covered by clothing. Which brings us to another visible area to check your nails. Changes in your fingernails or toenails can sometimes be indicators of health issues, including a less common but very serious type of melanoma that occurs under the nail subungual melanoma. Look for new dark streaks or bands under the nail that aren't due to an injury, lifting of the nail from the nail bed, or splitting of the nail. Again, any persistent change that isn't explained by an obvious cause like dropping something on your toe should be looked at. The key takeaway here is that your body gives you visible clues, and paying attention to any persistent or changing spot, mark, or area on your skin, including your nails, is a simple yet incredibly powerful health habit. It's about being observant and proactive, not being overly anxious. Getting familiar with what's normal for you is the first and most important step. That way, you'll be much more likely to notice if something changes. And remember, just because you notice something unusual doesn't automatically mean it's cancer. Most skin changes are harmless, but only a doctor can tell you for sure. Being vigilant means catching the few that are problematic at the earliest, most treatable stage. So, we've talked about why paying attention to changes in your skin, specifically moles and other visible marks, is so important. We've looked at the ABCDEs for moles and discussed other signs like non-healing sores and persistent patches. The absolute crucial message behind all of this is the power of early detection. When potential skin cancers or other issues are found early, often while they are still small and localized to the top layers of the skin, they are almost always highly curable. The treatment is typically simpler, less invasive, and the chances of a full recovery are extremely high. Think of it like spotting a small leak in your roof versus discovering major water damage after years of ignoring it. Addressing the small leak is much easier and less costly than dealing with a compromised structure. The same principle applies to health concerns identified through these visible signs. Being aware and checking your skin regularly, maybe once a month, doesn't need to be a source of fear. Instead, view it as an act of self-care, a proactive step in managing your health. It's about being an active participant in your well-being. You are the best person to notice changes on your own body. You see your skin every day, unlike a doctor who might see you once a year. Getting to know your own skin and your individual pattern of moles and marks empowers you. You become the frontline defender of your health in this regard. Don't feel like you need to be a medical expert or diagnose yourself. Your job is simply to notice if something looks different or isn't going away, and then to act on that by getting it checked by a healthcare professional. Talking about checking your skin, how can you do it effectively? It's simple. Find a well-lit room. Maybe use a full-length mirror and a hand mirror to see hard-to-reach areas like your back, the backs of your legs, and your scalp. Go from head to toe, checking all areas. Look at your face, ears, neck, and scalp. Part your hair, Check the front and back of your torso, your arms, palms, fingers, and under your nails. Don't forget your legs, the soles of your feet, toes, and under your toenails. If you have a partner or a trusted family member, they can help you check your back and other areas you can't easily see yourself. Make it a routine, like brushing your teeth or taking your medications. A set day each month can help you remember. If you do notice something that concerns you, maybe a mole that's changed, a new bump, or a sore that won't heal, don't delay in making an appointment to see your doctor or a dermatologist, a skin specialist. It's understandable to feel a bit anxious when you notice something unusual. But try to reframe that anxiety into positive action. Remember, the vast majority of the time, these things turn out to be harmless. But for that small percentage that are not, getting them looked at early is absolutely critical. Waiting can allow a problem to grow and become more difficult to treat. Doctors are there to help, and they would much rather you come in to get something checked that turns out to be nothing serious than wait and come in when a treatable condition has become much more complex. Don't apologize for bothering them. It's literally their job to help you stay healthy. Many people, especially as they get older, might dismiss changes as just age spots or other normal signs of aging. While it's true that we get more spots as we age, like liver spots or seborrheic keratoses, which are usually harmless, it's impossible to tell the difference between a benign age spot and a potentially cancerous lesion just by looking at it yourself. That's why professional evaluation is so important. A doctor has the training and tools like a dermatoscope, which is a magnifying tool used to look at skin lesions to properly assess the nature of a spot. Even if you're unsure, it's always best to err on the side of caution and get it checked. Peace of mind is invaluable, and catching something early can be life-saving. Remember, taking care of your health in your senior years is about maintaining your quality of life and independence for as long as possible. Paying attention to the visible signs your body gives you, like those on your skin, is a vital part of that. It's not about dwelling on potential problems, but about being empowered with knowledge and taking simple, proactive steps. You have the ability to be your own best advocate by simply looking at your skin regularly and seeking professional advice when you notice changes. This isn't about predicting doom. It's about maximizing your chances of staying healthy and enjoying your life to the fullest. Small, consistent habits like regular skin checks can have an enormous positive impact over time. I hope this information has been helpful and perhaps a little bit surprising, showing you just how important those visible spots on your body can be as indicators of what's going on inside. It's a powerful reminder that our bodies are constantly communicating with us if we just take the time to look and listen. Being aware of the changes in your skin, knowing the ABCDEs, and understanding that other visible signs matter too, is not about being anxious. It's about being informed and proactive. We've covered the importance of checking your skin, what types of changes in moles and other spots to look for, and why getting them checked by a doctor is crucial. This is a simple habit that can truly make a big difference in detecting potential issues like skin cancer at their earliest, most treatable stages. Remember, small changes can make a big difference to your health and happiness. Being vigilant about your skin is one of the easiest and most effective ways to protect yourself. Don't put it off. Start today by taking a few minutes to look at your skin. If you noticed anything while watching this video that gives you pause, please make that appointment to see your doctor. It's the best thing you can do for yourself. What are your thoughts on this? Do you already regularly check your skin? Or is this something you might start doing now? Share your experiences or questions in the comments below. Connecting with others on health topics can be really encouraging and informative. If you found this video helpful, please give it a like. It helps us know we're providing information that matters to you. And don't forget to subscribe to our channel for more videos on staying healthy, active, and living your best life at every age. We cover topics from nutrition and exercise to maintaining your memory and managing common health concerns, all aimed at helping you thrive. Thank you for watching and for taking this important step towards better health. Live your best life at every age.